My name is Kathy Deaver. I'm a wound care nurse practitioner at St. Joseph's Wound Clinic. I have a master's degree from West Virginia Wesleyan College, and I'm wound care certified through the American Board of Wound Management. We treat a wide variety of wounds in the wound clinic, everything from pressure ulcers to venous stasis ulcers, diabetic foot ulcers, any kinds of vascular disease. There's no particular group that we see, but we do have a large variety of older adults as well as diabetics in the community. To determine the best course of pretreatment, the first thing we need to do is assess the patient. We need to determine what type of wound they have, what ability they have to provide their own wound care, and what types of assistance and resources that they need. Common mistakes that we see in people attempting to manage wounds at home is, first of all, waiting too long to seek treatment. Oftentimes people will seek advice from their neighbors or from the internet, which, while sometimes can be beneficial, can also not be appropriate for their type of wound and can be detrimental to their condition. In patients with chronic wounds, we need to determine what their goals of care are. Not every wound can be healed, but there are things that we can do to help manage the symptoms and make the patient more comfortable. For those with underlying health conditions, it's important for the patient to remember that those underlying health conditions, such as diabetes or poor nutrition, can affect their wound healing. It's very important to make sure that those conditions are well managed. For example, diabetics need to maintain tight glycemic control, and people need to maintain good nutrition in order for wounds to heal. Patient education is critical to effective wound care. We make sure that we show the patient each visit how to do their dressings properly. We work with their family and their caregivers to make sure that they understand how to do the appropriate dressings. We also work with patients to make sure they understand the effective nutrition, glycemic control, as well as turning, repositioning, or any other factors that may affect their wound. Don't hesitate to seek care. Talk to your primary care provider or call the St. Joseph's Wound Clinic, and we will be thrilled to help you. The longer you wait to seek care for your wound, the more risk there are for complications, and there is no question too big or too small.